Good evening, friends. I'm myself, Dr. Shiv Shankar. In my earlier video, I had told that observation is very, very important. Observation helps in understanding the dispositional features of the patient. Thereby, we can arrive at the remedy. Few of my friends had asked me that, sir, give me the practical illustration so that we can understand better. So now I am making few videos so that I'm telling the few cute cases. How did I solve through the observation so that you can get a proper idea, still more clarity. Dear friends, a 46-year-old male patient came to our OPD around 1.5 months back. He came with the complaints of weakness after chemotherapy. 2 years back, he was suffering from the growth in the nose and the throat. It was said that carcinoma of nasopharynx. He had undergone nearly 4 times chemotherapy, 35 times radiotherapy. After chemo and radiotherapy, the doctors said that, okay, you are cured of cancer. But since a year, patient is lean, thin, appetite is less. He had mild pain while swallowing. He was having giddiness. For these complaints, he had come to us. On observation, he was lean, thin. He said, earlier I was little bit fat, sir. After chemotherapy, I became little bit weak. He has become little bit emaciated. So this is the scenario. His main complaints are weakness, emaciation, pain in the throat, appetite is less, he gets giddiness, and after chemotherapy there is increased, creatinine level. So on observation, what did I observe? Here to tell, I asked, what is your name? Sir, Hari Babu, sir. Where are you from? Sir, I am from Davanagere, sir. Davanagere, sir. ಓಕೆ ಏನು ತೊಂದರೆ ಆಗುತ್ತೆ ನಿಮಗೆ ಸರ್? ನುಂಗ್ಬೇಕಂದ್ರೆ ಇಲ್ಲಿ ಗಂಟ್ಲು ನೋವು ಬರುತ್ತೆ ಸರ್. ಇಲ್ಲಿ ಹೊಟ್ಟೆ ಹಸಿವು ಅಷ್ಟೊಂದು ಆಗಲ್ಲ ಸರ್. ಅವಾಗವಾಗ ತಲೆ ಸುತ್ತು ಬರುತ್ತೆ ಸರ್. ಸ್ವಲ್ಪ ಸುಸ್ತು ಸರ್. ಮುಂಚೆ ದಪ್ಪಗಿದ್ದೆ ಸರ್, ಈಗ ಒಂದು ವರ್ಷದಿಂದ ಸ್ವಲ್ಪ ತೆಳಗಾಗ್ಬಿಟ್ಟಿದ್ದೀನಿ ಸರ್. ಓಕೆ, ಐ ಆಸ್ಕ್ಡ್ ಹಿಮ್, ಹೊಟ್ಟೆ ಹಸಿವು ಹೆಂಗಿದೆ? ಪರವಾಗಿಲ್ಲ ಸರ್. ಬಾಯಾರಿಕೆ ಪರವಾಗಿಲ್ಲ. ವೇರ್ ಆರ್ ಯು ಬಾರ್ನ್ ಅಂಡ್ ಬ್ರಾಟ್ ಅಪ್? ಎಲ್ಲಿ ಮಟ್ಟ ಓದಿದ್ದೀರಿ? ಸರ್, ನಾನು 7ನೇ ಕ್ಲಾಸು ಓದಿದ್ದೆ ಸರ್. ನಾನು ನಮ್ಮ ಮಾವರ ಮನೆಗೆ ಆಂಧ್ರದಲ್ಲಿ ಹೋಗಿದ್ದೆ. ಅಲ್ಲಿ ಹೊಲದಲ್ಲಿ ಕೆಲಸ ಮಾಡ್ತಿದ್ದೆ ಸರ್. ಅಲ್ಲಿ ಸ್ಟಡೀಸಲ್ಲಿ, ವಿದ್ಯಾಭ್ಯಾಸದಲ್ಲಿ ಅಷ್ಟಂತೂ ಏನೋ ಚೆನ್ನಾಗಿರಲಿಲ್ಲ ಸರ್. ವಾಟ್ ಡಿಡ್ ಐ ಅಬ್ಸರ್ವ್? ಹಿ ವಾಸ್ ಆನ್ಸರಿಂಗ್ ಸ್ಲೋಲಿ and he used to think and answers. Think and answers. He thinks and answers slowly, answering as if confused something, answering slowly, and he used to frown while talking, and there were horizontal wrinkles over forehead. I considered all these rubrics: mind answering confused as if something else, answering slowly, mind just slow, and frown disposed to, wrinkles over the forehead. I got the remedies like Helleborus, acid phos, and Lycopodium sulfur. After referring to Metramedica, I arrived at the remedy Helleborus. I gave Helleborus 201 dose 1.5 months back. After 15 days, he came back for the follow-up. In the follow-up, when I saw, he was emaciated in the first visit. In the second visit, in the follow-up, what I saw, his face was glowing. He had put slightly weight. He told, sir, pain in the throat reduced almost nearly 50 to 60%. I'm able to swallow the food well. And this time he is able to speak fast. Earlier he was speaking slowly. Now his face is glowing. Now he is able to tell, ಹೇಗಿದ್ದೀರಿ ಸರ್? ಚೆನ್ನಾಗಿದ್ದೀನಿ ಸರ್. ಈಗ ಗಂಟ್ಲು ನೋವು ಕಡಿಮೆ ಆಗಿದೆ ಸರ್. ಈಗ ಸ್ವಲ್ಪ ಸುಸ್ತು ನಿಶಕ್ತಿ ಎಲ್ಲ ಕಡಿಮೆ ಆಗಿದೆ ಸರ್. ಈಗ now his flow of talk, his rate of speech has improved. Okay, now he tells, sir, I am feeling some energy in the body. I feel my mind, I was very slow, now my mind is little bit I become little bit fast. Okay, even his creatinine level had come down after 15 days. So here I could arrive at the remedy because of observation. Whatever I observed, I decoded it into proper rubrics. I got a group of drugs. Afterwards, I referred the final court of appeal, that is Medramedica. I could arrive at the remedy Heliborus. The close running remedy was Lycopodium. But Lycopodium, it has frown dispersive, vertical, horizontal wrinkles over the forehead, but answering slowly, the slowness was not covered by Lycopodium. Acid fast covers slowness while talking, but it covers weakness. The frown disposed to the vertical wrinkles over forehead. This was peculiar symptom which was not covered by acid fast. So Heliborus helped him a lot. Many times we say the remedy should cover pathophysiology. Here Heliborus is a very small, short-acting remedy, but covering the more peculiar mental symptoms. That's why it could help the patient. We say no, many times totality is not numerical aggregate of symptoms. Totality is sum of qualitative symptom. The weakness, pain in the throat, emaciation, all these are the common symptoms. 10 patients who are suffering from weakness post chemotherapy, everybody will not speak slowly. Everybody will not have wrinkles. Everybody will not frown while talking. These are the peculiar symptoms of the patient. Here, this case is an illustration how observation helps us to arrive at the right remedy. I was treating one more case, a 74-year-old male. He came with itching and dark discoloration of the forearm and legs since nearly 4 or 5 months. And since 2 years, he is suffering from frequent urination. Daytimes, he used to pass 5 to 6 times, night nearly 7 to 8 times. It was a case of prostatomegaly, and he was suffering from hypothyroidism post-COVID. So these were the presenting complaints. His mother tongue was Telugu. My mother tongue is Kannada. He did not know English. And at the time, even the evening internees also did not know Telugu much. Okay, because of language barrier, what I observed in him, he was sitting straight, slightly bending forward. He was not opening up much. And he used to, he had vertical wrinkles over the forehead as there was barrier of language. Earlier, I had given him Lycopodium. Unfortunately, Lycopodium did not help him much. So, in the follow-up, what I observed, whenever he used to see me, he used to wish me, "Sir, namaste, sir." And the other evening doctors, one madam is there, to her also, though she is not his doctor, okay, but still he used to wish, "Namaste, madam." Every time he used to come, he used to wish, "Namaste, sir." And he used to enter my chamber and he used to take treatment. While going also, he used to say, "Sir, namaste, sir." And he used to go to pharmacist and collect the medicine while leaving the premise also, "Sir, namaste, sir." I decoded into rubric reverence for those around him. And he has wide mouth. He was an emotional person. Once he came with his friend told he's an emotional person, a little bit talkative, friendly person. Thermally he was hot. There was itching, which he used to scratch a lot until it used to bleed, and there was burning pain, which was better by cold application. In the third visit, I gave the remedy sulfur 201 dose. After a week, he came and he told, "Sir, now my frequency of urination daytime 3 to 4 times, night around 3 to 4 times. Earlier it was 7 to 8 times." Again, I gave sulfur 200, 2 more doses, water dose, deviator dose. After a week, patient came. He was waiting for me in the waiting hall. The moment I saw the patient, he was a 74-year-old patient. The moment I saw him, he was looking quite young, very dynamic. I told him, "Yasman Ray, looking 5 years younger than your age." 74-year-old man looking now is like 68, 69. One more peculiarity the thing is, in the 2 visits, what I had observed, he was wearing always white shirt and white lungi. So in the books it was mentioned, in the nucleus it was mentioned that Shripad Kedekaran mentioned that sulfur patient likes white clothes. White shirt, white lungi always. Since 40 years he is wearing the white clothes. He is not a politician. So the observation was he was wearing white clothes, reverence for those around him, and other symptoms led me to arrive at the remedy sulfur, which almost cured him. Now in the subsequent follow-up, a 74-year-old man, now looking like 64-year-old. The right constitutional remedy will reverse the biological age. His chronological is 74, but biological age is 64. His sleep improved, he had become lively. Now he tells that skin eruptions almost, skin itching, skin eruption almost gone. The black discoloration of the skin almost reduced. His face is glowing, sleep is good, appetite is improved, he is smiling, talkative. Okay, we see the aphorism 253. The sense of comfort had come in him. So again, this is the case. In this case also, I could arrive at the right remedy because of observation. I will also mention few more cases in my upcoming video, how observation helped me to arrive at the right remedy. Okay, keep watching my channel, and please, if you like my videos, encourage me through your like button and subscribe to my channel. Thank you one and all.